So once again, my name is James Kim. I'm a family doctor from Calgary. And I guess, I guess if you're from outside Calgary, you must be thinking that Calgary is like the place to be because, like, I'm here, Dr. Swain is here, and Dr. Ward is here. So, and I guess it is the best place in Canada. But anyway, I guess it's up for debate. So, I had a privilege to be the lead author of the Diabetes Canada's guideline on people living with type 2 diabetes and MASLD and want to just share with you. So this is my disclosure. And the objective for my next 10 minutes is to really apply the workflow strategies to optimize efficiency and improve patient care in primary care setting. So this is the algorithm that we came up with in Diabetes Canada. It's very similar to what Dr. Swain have shown, except that I think ours is prettier. And but anyway, well, we'll just go through this with you. So we have recommended. Please keep in mind that this is not a general hepatology guideline. This was Diabetes Canada's guideline when we're looking at people living with MASLD, because as you know, it's about 65 to 70% of the people with type 2 diabetes actually have MASLD, and it will be very interesting to see what the prevalence and the overall number would be if you add pre-diabetes as well. So if you identify a person with type 2 diabetes and pre-diabetes, then we asked the recommendation was to do FIB-4. So then if the FIB-4 is less than 1.3, then as Dr. Swain has mentioned, then we recommended that no advanced fibrosis is the likelihood of having a advanced fibrosis is very, very slim. It's a 95% likelihood that you're dealing with the very mild form of fibrosis. So you keep them in your clinic, in primary care or in endocrinology or internal medicine clinic, and focus a lot on their metabolic profile management. We actually made a recommendation to reassess FIB for 1 to 2 years, and that really depends on the patient's metabolic profile. And we've heard from many specialists that they would prefer to repeat the FIB-4 test, especially if the person were to have a type 2 diabetes, because when someone has type 2 diabetes with MASLD, then that type 2 diabetes makes the MASLD like a little beast. Now, I want to ask you just to remember this one number, 1.3, and I think that's all you need to remember, and I'll explain why. Now, so if you have someone that is a low risk, then it's less than 1.3. So 1.30. Okay, now if you want to, if you think that okay, this person actually has a high likelihood of having a advanced fibrosis, then what you do is that you take 1.3 times by 2, and then you get 2.6. So, but then I learned from my teenage kids that what's the latest saying? 6, 7. It's very annoying, but it's been like drilled into me. So then what I would say is that you just remember that one number, 1.3. If it's a mild case, then less than 1.3. But if you think it's really bad, then you take 1.3 times by 2, you get 2.6, and you get 6, 7, right? Now you get 2.67. If you understand that, if you have teenage kids, then I swear you will never forget this, and it will be stuck in your head. So and then you get advanced fibrosis. Then the chance of that person having advanced fibrosis is actually quite high. And then the referral to the gastroenterologist or hepatologist will be required. Now, it depends on who you have available, obviously. Then it could be gastroenterologist or it could be hepatologist. But the key thing is that while the patient is waiting to see them, and while they are still being seen by the gastroenterologist or hepatologist, our job in primary care is to still manage their metabolic issues because it can really slow down and maybe reverse some of those fibrotic stages. Now, what if the person's FIB-4 comes between 1.3 and 2.67? Well, then it becomes intermediate, and they do require secondary test. Over the last few days, I've found out that shear wave elastography is also available quite readily outside Alberta. In Alberta, we are very fortunate to have shear wave. There are three private radiology companies that are performing the shear wave elastography, where the patients do not have to pay. I've been told that in certain provinces they may have to pay, but sometimes it's actually covered. And then ELF test, as Dr. Swain mentioned, is about $120, $160. That's my understanding. And depending on what it shows, and if it's and you can see the number on the diagram. that if the person has a low advanced fibrosis, once again, we manage them in our clinic, just focus on the metabolic profile. And I would actually say that it has to be pretty aggressive metabolic profile. It's a good reason to be actually quite aggressive as well. Now, if the ELF score or shear wave elastography scores are high, then the likelihood of them having an advanced fibrosis just goes up quite a bit. Then they do require a referral to gastroenterologists and hepatologists. And once again, meanwhile, we as in a primary care should really focus on dealing and managing their metabolic profiles, because what we all have to appreciate is the fact that yes, there's a fibrotic event going on, but yet what is fueling that whole fibrosis is actually the whole metabolic process. Because we should also appreciate the fact that the whole MASLD is a systemic condition where the actual manifestation of metabolic issues is actually happening in the liver. So it is a systemic metabolic issues. So we still have to address the whole metabolic profiles. Now, we do also appreciate the fact that there are a number of places in Canada where the shear wave elastography and ELF are not available. Then we do recommend that if the FIB-4 is greater than 1.3, then consider referring the patients to a gastroenterologist and hepatologist. So that's the quick algorithm that we came up with in Diabetes Canada. And about an hour later, we'll discuss what we came up with in terms of the management of the MASLD patients from the medication or pharmacologic perspective. Okay, thank you. And yeah, I guess we'll
Yeah,
have Dr.
thank,
Swain back. Yeah. And Dr. Ward, sorry.
yeah, no,
Yeah.
good. Thanks very much, James. And just a sort of a historic question, and maybe this is, I'll turn this over to Mark. Well, actually, either of you, but genetic testing for MASLD or fatty liver disease, is there any intel on that?
There's lots of intel, but no action. It's I think it's something we would all be quite interested in, and there are actually score cards that actually incorporate those, but it's not something that we can access yet.
Good. So not ready for prime time.
Not ready for prime time.
James, you made the really good comment and point that although our focus today is on MASLD and the liver, that the metabolic side of this, the inflammatory response that we get, is not just liver related. So, what kinds of other things are you thinking about in managing your patients with MASLD that go beyond the liver with that inflammatory lens on?
Yes, so we'll talk more about that in about 1 hour's time when we talk about the medications. But first thing that I want to mention that I think as a primary care, we often leave out, unfortunately, well, at least I do, is their lifestyle modifications. And it is very, very important. And we often forget about it. And we often talk about Mediterranean diet because that's the one that has the most research on it. And you go to Asian populations where I deal with a lot of Asian immigrant populations and tell them that, hey, you have to be on a Mediterranean diet. And they like, that's not going to happen because it just won't be feasible with their culture and their belief and so on. So we should never forget about the lifestyle modifications, diet and exercise. And we actually made some good recommendations in our guidelines as to what we can recommend.
And actually, to build on that just very briefly, the one thing that I always ask is about fructose sweetened beverages. That there are people that have no other overt, obvious metabolic risk factor, but they drink like 2 liters of Coke a day, and just getting them to stop that or switch to diet pop can make a massive difference in their FibroScan readings, their CAP readings. It's quite striking. The other thing is coffee. I actually ask about coffee, and I encourage them to drink coffee, and not a double double from Tim Hortons, but a like a coffee without adding sugar, and so those are the two things that I kind of do from specifically on a diet. Obviously, cutting back carbohydrates too.
Thanks, and
The
lots
ultra
of
processed foods, yeah.
Yeah, and lots of comments in the chat, and Melina's reminding us that hey, don't steal my thunder for a little bit later on. So listen, guys, thanks very much, and great perspective, and again, nice algorithmic approach to how we investigate patients with fatty liver disease.